Hi, everyone. This is Dr. Kimberly Sanders of ArthroWell Naturopathic. So like us on Facebook, follow us on Instagram at ArthroWell. We have a Facebook group where we go over lots and lots of good information for autoimmune disease. It's called Research on Natural Medicine for Autoimmune Disease. So feel free to join us there on Facebook. And we have all of our all-natural physician-grade supplements available for the public. The link is here, wellevate.me/Kimberly-Sanders. And you can pop on there and just order all kinds of great brands of supplements just based off of things we talk about here, Claire Labs, Thorne, Pure Encapsulations, whatever brand. So that way you know you're getting good quality stuff. Just wanted to share that. And so as the owner of ArthroWell Naturopathic, I'm also the creator of the 6 Types of Autoimmunity, which is a categorization of the 6 most common types of autoimmune disease that I see in practice in functional medicine clinic for autoimmune disease. So today we are really going to talk about type 3 autoimmune disease. And so the title of this video is Can Lupus Cause Painful Periods? But I call it that just because so many people ask me specifically for lupus, but this really applies to any autoimmune disease. I would say lupus, Hashimoto's, and RA are the really dominant ones in terms of having a hormonal component and one of my type 3 hormonal autoimmunities. Of course, lupus and RA have sometimes other types. There's also the possibility of being a hybrid, but there's almost always a hormonal component, especially for lupus. And so if you have lupus, if you're watching this, how would you know that maybe you have a hormonal issue? Do you have painful periods, heavy periods, PMS, specifically irritability, bloating, breast tenderness before your period, usually about a week? And the longer before your period you feel those PMS symptoms, the more extreme your hormone dysregulation is. If you have PCOS, fibroids, endometriosis, fibrocystic breast disease, these would all be signs of potentially hormone imbalance. And so what's very common in women with autoimmune disease, again, specifically lupus, but many others, is an imbalance between estrogen and progesterone. So what we're really looking at is a lot of these women have very high estrogen combined with very low progesterone. And that mismatch gives a lot of incorrect signals to the immune system. And so estrogen, when it is too high and when it's allowed to just go out of control, very much triggers an antibody reaction. It also has been linked in research to trigger a T cell reaction. And so these are basically signals in the immune system that could potentially cause autoimmunity. And so when you see this estrogen out of control, what we're trying to decide is that maybe the main reason or one of the main reasons why your immune system is making all of these antibodies that are attacking your own body? And is there something we can do to maybe balance out those estrogen levels? And so I'll post some research studies in the comments because this is stuff that's been studied over time. One particular article, just to pull up the link in case anyone wants to look at it while we are talking here, is called Estrogens and Autoimmune Diseases. It's from 2006. The author is Kutolo. And so it's a really great article. Again, I'm going to post this in the comments, but it really talks about some of the mechanisms by which estrogen has the ability to trigger inflammation. It also talks about how inflammatory cytokines, which are basically inflammatory chemicals, are known to create more estrogen. And so these inflammatory chemicals, which we call interleukins, are created excessively in autoimmune disease, have also the ability to make more estrogen. Basically, they stimulate an enzyme called aromatase, and that aromatase makes estrogen. And so then you have more estrogen and potentially more inflammation. So it becomes a vicious cycle. This study also names progesterone and the androgens, testosterone, DHEA, as hormones that can maybe have a suppressive effect on the immune system. And so there's quite a bit of research on the role of DHEA in lupus. It does seem in some studies to show benefits, especially for fatigue and cognition and things. And so there may be an implication that if you have this estrogen very high and maybe lower levels of some of the good hormones like progesterone or DHEA, that there could then be kind of a bad combination, that you have an overstimulated immune system and not enough of the hormones that normally would regulate your immune system. It's very common for women, even women without autoimmune diseases, to have very low progesterone levels. Part of that is potentially maybe not ovulating well. Most of our progesterone comes from having a good, healthy ovulation. And progesterone can also be suppressed when we are stressed. So it's a good idea to check your progesterone levels. You really want to check them a few days after you've ovulated, which is when they're supposed to be the highest. And if we're seeing at that time that the progesterone is very low, that could maybe be partially what's going on as to why your immune system is so overreactive. The low progesterone could then let estrogen just run without having any kind of check. Progesterone normally helps to balance out estrogen and checks it. And so some signs of low progesterone would also be having periods that come very early. So if you're having periods that come every maybe 18 days, every 20 days, if you get more than one period in a month, that could maybe mean low progesterone. If you've struggled with infertility, that could mean low progesterone. Again, having very painful periods, heavy periods, all of that could mean low progesterone. So you might want to have that tested, in addition to maybe having your estrogen levels tested, and just look for the imbalance. DHEA is a helpful, relatively helpful hormone that we want enough of. We don't want that to be too high. There are problems if it's too high. But if it's too low, which has been pretty well documented to happen in autoimmune diseases, especially lupus, that is something that maybe we'd want to support. And then so another aspect of this is that estrogen, when it is either too high or out of balance with progesterone, it has to be processed out and detoxed through various pathways in the liver. And there are different options basically of how that can happen. And so we may not only want to measure total estrogen levels, but we might also want to measure metabolites. Some metabolites are better than others. There are different ones. You may have read about these. They're called the 2-hydroxy, the 4-hydroxy, or the 16-hydroxy. So I know it sounds, very advanced. And basically there are panels where you can measure these different metabolites, and you would want your body to be shunting to the right kinds rather than the bad, the less favorable kinds, because those metabolites of estrogen might be even worse than just the regular estrogen. And so basically these are all things that can be measured to confirm, is there a hormonal component to what's going on with your autoimmune disease? Secondly is another hormone called prolactin. And so there's some research that implicates prolactin levels being too high as a trigger for autoimmunity. Having high prolactin also would inhibit your ovulation. So if you have high prolactin, you might not ovulate, you might not make progesterone. So it's a little bit of a vicious cycle. Prolactin also has been shown to raise these inflammatory cytokines and also stimulate the immune system in a negative way. And so having prolactin levels checked is very important. There's some theories that lowering prolactin levels could be a major issue and a thing that's helpful for autoimmune disease. So I generally like to test them, especially if we think it's a type 3 autoimmune, meaning a hormonal autoimmunity, that the hormones are at play in your particular autoimmune disease. We want to check prolactin, estrogen, progesterone, DHEA, and all those estrogen metabolites. The other thing about prolactin is that it tends to go up when you are hypothyroid. Now, how common is hypothyroidism? Very common. So if you have lupus or RA, if you have any issues with your period and you have hypothyroidism, there could very well be a big hormonal aspect to what's going on. So when you're hypothyroid, your prolactin level may go up. That inhibits ovulation and could interfere with your estrogen and progesterone balance. So these things have to be looked at. The rheumatologist is not doing this. So many lupus patients contact me saying, I have heavy periods. There has to be a connection, but my rheumatologist doesn't know. There might be, you have to have these tests done. So find a functional practitioner who specializes in rheumatology, who can look at this for you. So again, I call this type 3 autoimmunity, meaning, yeah, you have lupus, you have RA, but it's really a hormone imbalance that's a major burden on your immune system. So I hope that is helpful. Once you then find these imbalances, there are just so many combinations of what could be found on a test. Maybe you have very high estrogen, but your progesterone's okay. If that's the case, we might just detoxify estrogen. If you have very high estrogen and really low progesterone, we may have to detox estrogen, but also raise progesterone. And there's lots of natural ways to do this. We're doing this without birth control. Birth control is handed out so easily. It has a lot of considerations that have to go into taking birth control when you have an autoimmune disease. So we do this naturally. We do this without birth control. It doesn't mean that if you're already on birth control that you have to come off or that we can't work with it, but we can work on it naturally without having to take a drug. So those are different options. If you also have high prolactin, we have to try to get that down. If you're not ovulating, we have to try and work on that. And so really we have to work on all these hormones, many moving parts, for sure, making sure the thyroid is optimal. We may have to tie in cortisol levels and look at those and make sure they're optimal. And so we need all the hormones to be balanced out in order for this type 3 kind of autoimmunity to start balancing down. The other issue with estrogen, why is estrogen such a problem? Why is it that women have high estrogen and low progesterone? It's because we also get a lot of what we call xenoestrogens from the outside environment. Many, many chemicals, pesticides, all these different toxins in our environment, and the plastics mimic estrogen in our body. And so that's just another factor as to why estrogen is so much more of a problem. It's because we're getting so much of it from the outside, from hormones in our food and our meats and dairy products. And so when we're trying to detoxify estrogen, there also comes into play a toxic component of just kind of cleaning up your food, cleaning up your household in terms of chemicals. Getting rid of plastics is really important if you're winding up showing too much estrogen. So that's another consideration is just the fact that we get so much estrogen from the outside. And then lastly, we also make more estrogen in our adipose, which is the medical term for fat cells. Fat cells have a high ability to turn on enzymes, aromatase enzymes that make estrogen. And so it's just yet another reason why we're so much more likely as women to have too much estrogen. It's because we also not only get it from the outside world, but also if we have a little bit excess body fat, we might actually make more estrogen. So these are just some reasons why we may have more than we'd like. So I think that covers everything I wanted to talk about. Basically, I just want to confirm for anyone listening that there's definitely a connection between lupus, RA, Hashimoto's, MS, all these different autoimmune diseases and your period. If you have felt that in your gut and you feel that that's a connection, you are not wrong, you are right. So reach out to me. Again, you can follow me on Facebook, on Instagram. ArthroWell Naturopathic is the name of my functional rheumatology clinic. You can like us on Facebook at ArthroWell Naturopathic. You can follow me on Instagram. And you can join my Facebook group, which is a really great forum for you to just ask questions, just have a community of like-minded people. And so I hope this was helpful. Please feel free to post any questions in the comments. I'm going to post a link to that research article I mentioned. And so please reach out, and I look forward to doing more of these. Have a great day.